Welcome to the Dementia Doctor. Today I have Dr. Leuchter here with me who is going to talk about TMS and how it can help us with the memory. Welcome, Dr. Leuchter.
Thank you so much for having me. I appreciate the warm welcome and I'm delighted to be here.
So tell us more about this word TMS. What does it actually mean?
Yeah, so TMS stands for Transcranial Magnetic Stimulation. It's a bit of a mouthful, so we say TMS for short. And basically it is a form of non-invasive brain stimulation that uses a magnet to help us interface with the brain, talk to the brain in its own language so that we can rewire networks in the brain.
So it seems like it's on the outside, non-invasive. Does it really help with things like memory issues and Alzheimer's?
Yeah, great question. So it was invented in 1985, actually, funnily enough, on a bet by a neurophysiologist in the UK. And then it eventually became FDA approved for the treatment of treatment-resistant depression, where it was shown to rewire a lot of brain networks, a lot of the wiring that goes awry in depression. In Alzheimer's, people have been looking at it for some time, but only more recently have we figured out the best networks for us to really be looking at, the best spots in the brain for us to target to see if we can actually try to resynchronize some of those brain waves that go awry.
Are there studies that show that this is particularly beneficial for individuals who face memory issues?
So there are a few studies out there. It's actually a bit early work as far as TMS in Alzheimer's disease or other forms of cognitive impairment. The furthest along so far, there's been one phase 3 study that was actually a negative study looking at one particular kind of TMS. Other kinds of TMS that are targeting different networks in the brain, at the back of the brain, those so far have gone as far as phase 2, and there are some planned phase 3 trials. But it's promising. It seems to indicate that we can interface with these disorganized brain networks and really put a conductor in front of a disorganized orchestra.
Okay. What would you explain to our listeners about phase 2 and phase 3 trials? Because a lot of times our families will hear about this and it would be really confusing to understand what does a phase 2 trial actually mean for them.
Phase 1 is really your early work that you are trying to establish that you can actually even execute the concept. That if I'm doing a phase 1 trial, I'm showing I can actually do this intervention I claim to be able to do. Phase 2, I'm trying to figure out a little bit more about its safety, a little bit more about efficacy and things along those lines, but it's still not really fully there yet. Phase 3 is when you're really saying, okay, now I am putting my chips down and I am saying this is or isn't going to work, and here's the trial to answer that.
Yes, exactly. And that's how I also talk to my families and patients. I say phase 1 is typically looking at safety, and it has individuals in sometimes even as less as 10 individuals. And then you go to phase 2 where you have hundreds of individuals, this time looking more at efficacy or the effectiveness of the drug. And phase 3 is when we talk about thousands of individuals getting the drug. And as physicians, we start trusting a medication or an intervention once it is reaching towards phase 3 or it's completed the phase 3, and we can use it in the clinics safely and effectively for our patients. One of the things that families often ask me is, are there any side effects? This sounds a little scary, a magnet on my head. Are there bad side effects from TMS?
Yeah, so the great news is TMS is safe, it is well tolerated, it is FDA approved for actually 4 other indications. And despite the fact that people may think, oh my goodness, I'm putting a magnet on my head, what's gonna happen? Is this even safe? It is actually quite safe. The most common side effect is no side effect at all.
Okay.
But when side effects do happen, most commonly it may be a little bit of discomfort under the magnet when the treatment is actually going, or it may be a little bit of a headache that lingers for a couple hours after an individual treatment, keeping in mind that, this is often a prolonged course of treatment. And then the serious but very rare side effect that we look out for is seizure, where it's about 1 in 30,000, which compared to many medications we use, actually is quite favorable. So TMS is effective for many different things. It is safe, and there are some really encouraging results for its use in Alzheimer's disease and other forms of dementia.
So for our listeners' understanding, how soon could the phase 2 trials of TMS result into this coming into clinics? Is it available in clinics already, off-label, or is it something that we should be hoping to come into the clinics?
So there are, there may or may not be various clinics that offer it off-label. I know that across the U.S. there are about over 1,900 TMS clinics. I can't tell you which ones do and don't offer some form of off-label TMS for Alzheimer's disease or other dementias. I can tell you that there's at least planned phase 3 studies that may be launching in the US in the not too distant future. I'm currently in the midst of conducting a pilot study, and that's going to go into a small randomized controlled trial looking at a slightly different form of TMS using purely off-the-shelf equipment so that we can avoid anything proprietary. But I am hoping that this is something we are going to be seeing deployed at scale in the not too distant future.
Okay, that's exciting news for our listeners. So I believe they can watch for it on clinicaltrials.gov.
Yes.
To find if the TMS trials are coming in your region and kind of to see if they can get enrolled in the trials. Thank you so much for coming to our channel and talking to us about TMS.
Of course, thank you so much for having me.